Hey everyone, welcome back to Daily Dollars. Today, we're breaking down the biggest Medicare changes coming in 2025, what's new, how it impacts you, and what to watch for in the future. With over 68 million Americans relying on Medicare, these updates matter. In fact, 94% of seniors say protecting Medicare is a top priority, and while 65% of beneficiaries feel Medicare has met their expectations, a staggering 63% worry it won't be there when they need it. So, what's changing in 2025? Stick with me as we go over the key updates that could affect your coverage, costs, and care. But before we dive in, don't forget to hit that like button and subscribe to Daily Dollars so you never miss important financial updates. Now, let's get started. First up, let's talk about costs. Medicare premiums and deductibles typically rise each year, and 2025 is no exception. However, the official rates for 2025 haven't been finalized yet. While we do expect increases, we'll have to wait for Medicare's official announcement before we know exactly how much Part B premiums and deductibles will go up. If you're on Medicare, be sure to keep an eye on those updates later this year. Now, for some good news, starting in 2025, Medicare Part D enrollees will have a $2,000 annual cap on out-of-pocket prescription drug costs. This means, once you hit that limit, Medicare will cover the remaining costs for the rest of the year. This change is part of the Inflation Reduction Act and is expected to provide major financial relief for those with high medication costs. Another big change is the end of the so-called donut hole in Medicare prescription drug coverage. Previously, Medicare beneficiaries faced a gap in coverage where they had to pay more out of pocket for prescriptions after reaching a certain spending threshold. In 2025, that gap will close completely. Here's how it will work. First, you'll pay up to a $590 deductible for prescriptions. After that, you'll only be responsible for 25% of your drug costs until you reach the $2,000 out-of-pocket cap. Once you hit that limit, Medicare covers the rest. This is a major step toward reducing out-of-pocket costs for seniors who rely on expensive medications. Mental health care is also expanding under Medicare in 2025. More providers will be able to serve Medicare patients, including licensed mental health counselors, marriage and family therapists, and addiction counselors. This expansion is designed to improve access to mental health services, which have been a growing concern for many seniors and retirees. If you or a loved one have struggled to find mental health care providers that accept Medicare, this change could make a big difference. Telehealth services became much more widely available during the pandemic, but some of those temporary expansions are set to expire in 2025. Moving forward, most Medicare-covered telehealth visits will require you to be in a rural medical facility rather than at home. However, there are a few key exceptions. You can still receive telehealth services from home for end-stage renal disease home dialysis visits, stroke diagnosis and treatment, mental health and substance use disorder services, behavioral health services, diabetes self-management training, and medical nutrition therapy. If you rely on telehealth, be sure to check with your provider to see if your services will still be covered in 2025. Medicare is also introducing new pilot programs to provide additional support for caregivers. This includes training programs to help family caregivers better care for their loved ones, additional assistance for those caring for hospice patients, and new resources for dementia patients and their caregivers. These changes aren't universal yet, but they represent an effort to improve support systems for families caring for aging relatives. A big change is coming for United States Postal Service workers and retirees. Starting in 2025, they'll be moved from the Federal Employee Health Benefits FEHB program to a new system called the Postal Service Health Benefits PSHB program. This new plan is still housed within the larger FEHB system, but it's specifically designed for postal workers and their families. If you or someone in your family is a USPS retiree, it's important to review these changes to ensure a smooth transition to the new program. These are the confirmed Medicare changes for 2025, but we could see even more updates in the near future. One major change that many people were expecting is Medicare's ability to negotiate drug prices. It won't start until 2026. That's when Medicare will begin negotiating prices for certain prescription drugs to lower costs for beneficiaries. Meanwhile, lawmakers continue to discuss other potential Medicare reforms, so more changes could be on the horizon. As always, we'll keep an eye on the latest updates and bring you the facts as soon as they're confirmed. So, what do you think about these Medicare changes? Are they helpful, or do you think more needs to be done? Let us know in the comments below. And if you found this information helpful, be sure to like, subscribe, and turn on notifications so you never miss an important financial update. Thanks for watching Daily Dollars, and we'll see you in the next video.